thank you for viewing our presentation on the LPN workforce in New Jersey, as described by LPNs and employers. My name is Sue Weaver, and I am joined today by Dr. Edna Cadmus and Dr. Pamela Dekordova. We work at the New Jersey Collaborating Center for Nursing, which was established by state legislation as New Jersey's Workforce Center. This qualitative study, which was funded by the National Council of State Boards of Nursing Center for Regulatory Excellence, focused on understanding the current practice of LPNs in New Jersey by describing and comparing the perceptions of LPNs and employers of LPNs about their roles and job functions across settings. Dr. Dekordova, can you tell us what is known about the LPN workforce in New Jersey?
So yes, thank you, Dr. Weaver. Licensed practical nurses, or LPNs as we know them, are essential members of the nursing workforce across the United States as well as in New Jersey. And with a growing aging population, there's an increased need for healthcare settings to use LPNs. The New Jersey Collaborating Center analyzes the workforce data that was delegated from the New Jersey Board of Nursing through a LPN license renewal survey. In our study period, we found that over 21,000 LPNs reported working in their primary employment settings were long-term care, home health care, and ambulatory care, and then hospitals. In this study, we are trying to understand more about the gap in the evidence in that we don't have information on the LPN role and job functions. And according to the New Jersey Practice Act, that delineates the practice of nursing for LPNs as simply performing tasks, reinforcing teaching, and providing care under the direction of the RN. However, the RN shall not delegate the assessment of the patient. So in this study, we conducted a qualitative descriptive study to gain a broader understanding about the LPN's role, as well as the perspective from both the LPN and the LPN employer. And we really wanted to know if the LPNs were working within their scope of practice. So we conducted a 10 in-person focus groups, and they were held in 8 counties. 43 LPNs participated. The average age was 46, and they had an average of 8.5 years in their current position. Similar to the New Jersey Collaborating Center data and national LPN data, we found that the majority of the LPNs who participated in our focus groups worked in long-term care, subacute, or assisted living. Then we looked at LPN employers, and we interviewed 17 LPN employers. And similar to the Collaborating Center's data, we found that the LPNs who worked in long-term care, or the LPNs who hired LPNs, worked in subacute, assisted living, and home health. Now, these employers that were interviewed were directors of nursing. And these employers hired LPNs in the full-time, part-time, and per diem positions. And then the number of LPNs that worked in these facilities among these 17 employers ranged from 4 employees all the way to 750 employees.
Thank you. So what were our findings? This slide shows the common themes from both the focus groups and the interviews. According to the LPNs and employers, there is uncertainty in the future of LPNs. There is and will be a continued demand and need for LPNs in the home care and long-term setting. And LPN explained, there's so many opportunities in nursing homes and long-term care facilities, and even in home care, because you take on such responsibility. They're always hiring. However, many LPNs worried about their future and whether they will be needed or we're going to die out, unfortunately. Another theme was the need for more hands-on experience. Both the employers and LPNs identified this need for more hands-on for new graduate LPNs because you learn on the job, said an LPN. This slide shows the themes that emerged from the focus group discussions with LPNs. The primary theme was LPNs question what they should do, can do, and will do, illustrating the LPN's perception of role confusion and just doing what the facility demands. And LPN explained this role confusion which stems from working at different facilities and being allowed or not allowed to perform certain procedures. The scope of practice, it varies in each facility you work in. Depends on what you can do and what you can't do, said an LPN. While another LPN said, if an admission comes in, I can do the complete admission, but I need the RN to sign off on that. You can do the assessment, but the RN has to sign off on it. What she's supposed to do is go and do the assessment. Another theme was LPNs are stuck in their role. And this illustrates the conundrum for LPNs who believe it is nearly impossible to go back to school, along with being unable to advance in their role or positions. Lastly, LPNs pray they make it through their shift, emerged as a theme from the focus groups and illustrates the challenges of working in long-term care. An LPN provides an example of her angst with the heavy workload on an evening shift in long-term care. She said, I had 34 patients on 3 to 11 in a long-term care with one over from subacute and others that had dementia that really should have been on a locked unit. That used to be my full-time job. And I cried on my way to work every single day because I was so afraid that someone was going to die. From the interviews with the LPN employers, the primary theme was that LPNs and RNs are pretty much interchangeable in practice, whether working as a staff nurse in long-term care or in the field in a patient's home. An employer stated, the LPNs and RNs are pretty much interchangeable in the field as providing skilled nursing care to our clients. At one organization, the orientation program for RNs and LPNs is exactly the same, except different competency related to wound vac and PICC line. An employer recognized that the way our policies are written is they are able to do the same activities as the RN, but there's always an RN on duty with them. Another theme from the LPN employer interviews was LPNs make economic sense. The employers explained quite frankly that based on the reimbursement their organization receives, it makes financial sense to hire LPNs who are paid at a lower rate than RNs. So now, Dr. Cadmus, can you tell us what are the next steps to provide clarity and scope of practice for LPNs in New Jersey?
Thank you, Dr. Weaver. This is a very important exploratory work for the state of New Jersey, which will really inform the quantitative work, which is our next step around job functions. In caring for patients across settings, LPNs have expanded their role work at the top of their license and beyond. This is demonstrated by their uncertainty of what they can do and what they should do as an LPN. While state nurse practice acts and regulations should drive LPN practice, organizational policies often dictate how scope of practice is applied. To ensure a clear understanding of the LPN role and scope of practice, formal workshops really re-examining and discussing their role and preparation should be conducted at the state level through the Board of Nursing and at the practice settings to help leaders and staff apply scope of practice standards consistently. Modules can be designed to provide clarity regarding the Nurse Practice Act, scope of practice standards, and role implications for LPNs and RNs. This study underscores the important role that LPNs have in providing care to patients across settings. Ensuring that regulations and education keep pace with the changes in the healthcare system, it will benefit our patients, our staff, and our organizations. Thank you.